morning or afternoon, all the way from Texas. To my new friends from Turkey, thank you for having me. I'm Maria De Leon, and I am a neurologist, Parkinson's specialist by profession. And I have been a caregiver to my grandmother who had Parkinson's, and then I developed Parkinson's at a young age in my 30s. So I've been living with Parkinson's disease for 17 years. And so I've been learning a lot from what it's like to be a chronically ill woman and patient and mother and wife, and it's been a journey, and I am glad that it's brought me to people like you guys. It's connected me to a lot of people in the world, and I'm really, really thankful for that part. So thank you for having me here. I thought I was a pretty good doctor. I thought I was pretty good at diagnosing and relating my patients, and seeing the needs of the Parkinson's community, until I had my grandmother to take care of, and realized in her end stages how much burden it took on the caregivers, on the loved ones, on even when you have all the resources. I was working and I had help during the day, but I took care of her at night and I took care of her on the weekends. And without my husband's help, I would not have been able to do this. I mean, it was a 24-hour, 7-day, care, constant, emotional and financial and straining relationships. And, when you're working and you have a toddler and you have a kid and you have a, elderly person to care for, and they're psychotic, and you go to work and they're psychotic and they're falling, you come home and they're falling and they're psychotic. So, it's like a vicious cycle, and it really does wear on you, even though I would do it again in a heartbeat. And I love the time that I got to spend with her. It really brought us together. It really was, when she passed away, it was kind of a sigh of relief, because you're so exhausted, you're so drained emotionally, especially when they get confused and they get disoriented, and they start, sometimes blaming you because, they feel like you're keeping them hostage, or you don't let them see other people, you don't take them out, or, just seeing them, I had to feed her, I had to bathe her, and so it's really, really hard. And I started recognizing in my patients' families this kind of stress, this kind of, mental anguish, this kind of frustration. You feel like you want to put them away, but at the same time, you're torn. And I did that with my grandmother for 1 week. I was so exhausted. I needed to sleep. My husband needed to go away on to see his family, and I thought I would put her in one of the nursing homes as respite, to help me just to get a little bit of rest myself. And what I learned is that I spent every day over there at the nursing home anyway, because she got more confused, more psychotic, more disoriented, unhappy, and I had to be there anyway every day. So it gave me a little bit of rest because I didn't have people here in my house all the time, but it was still emotionally, I couldn't really let go. So it's still, whether they're at home or whether in a nursing home, you still have that emotional impact. You still have that constant pull and connection. And that was something that, I could then talk to my patient's family about, having time for themselves, about being able to go and then leave them, for a little bit and have other people help. And sometimes just a shoulder to cry because you're so tired, you're so exhausted, you just want to talk to somebody. So that was an experience. And what sometimes, you realize that when you go to the doctor, everybody's so focused on the patient, but nobody talks to the family about, hey, what's going on? Are you okay? Are you sleeping? Do you need anything? Is somebody helping you? And so that was something that really was an eye-opening. And of course, sorry, my mouth gets so dry. Of course, then when I developed the disease, initially, being a young woman, it was really hard because everyone thought, well, how can a young woman have this? How can, she's Hispanic, she is only 30, why is she, saying that she has the symptoms? And of course, being young also didn't have the typical, I had some tremors and I still have some tremors, but they're not my major part. I still have very minor tremors, even after all these years. So everybody would say, well, you're not shaking, so you can't have Parkinson's. Or, I had a lot of fatigue, and I had a lot of visual field defects, which was not common at that time. And so, of course, everybody thought, and even myself being a specialist thought, well, this is not something I usually see with Parkinson's, pain and fatigue and visual problems. So even I thought, we have to look at other things. And so I spent 3 years going to doctors, trying to find the diagnosis, and saw every specialist. And everybody said, oh, there's nothing wrong with you. Oh, you just need to go back to work. Just take care of your patients. You're just depressed. You're just sad. And so that was very, very difficult and eye-opening too, that here I was a professional, a woman that was a specialist. And still, when it came to me being treated as a patient, I was treated, no different than anybody else, that, they just saw a minority woman, Hispanic, young, and they said, oh, you can't have this. You just tired, you just fatigued, you need a psychiatrist. And so that was very, very hard. And like I said, it took 3 years to get diagnosed. And that was an eye opener. During those 3 years, I suffered a lot, with my family, with my patients, trying to keep going and do things while I was having issues. And so I always say that being a patient and being a doctor are two opposing poles. On the one hand, I understand exactly what a doctor needs, what's important. You want to make sure that, you're not going to fall and break a hip, that you're not going to choke and, have pneumonia, end up in the hospital. But as a patient, I want to make sure that I can do my nails, that I can do my hair, that I can crack an egg, that I can, take care of my daughter, clean the house. Nobody ever asked that, that I can drive my daughter to school, that I can, do those kind of things. And so it's very important what I started seeing as a patient. I always say that patients are the most impatient. We're not patient. When you're sick and hurting, you want somebody to listen. You want somebody to take care of you now. And you don't want to wait. I mean, as a doctor, I know that, you got to do tests and you got to wait a week. You got to see what goes on, the differential. I understand that. I know I'm a physician, but at the same time, when you're hurting and you can't, crack an egg, you can't dress yourself, you can't pull your underwear, you can't pull your pants up. You're like, okay, I need this to be over. And, waiting a week or 2 weeks to see the doctor or for the medicines to kick in, that can be very frustrating. And sometimes you just feel like, you're so vulnerable, and you're wearing all your emotions on your sleeves, and you go to see a doctor and they say, well, what's wrong with you? Why can't you get it together? And you're like, I've been getting it together. It's just that now I just can't do it anymore. So it's hard sometimes. And I think women are more, emotional in that regards. And especially when we have hormonal issues, and we tend to be a little bit more, sensitive to pain, to fatigue, to, sleep disturbances. And as I've discovered, and that having periods really worsens the symptoms. So that's one of the things that we've been working on, trying to recognize how we can improve that, how we can change that, why that is. And so it's been a journey. 3 to 5 years for women to get diagnosed, especially if they're young, and especially if they're minorities. It takes longer, even when they see the same doctors. And I saw, specialists and Parkinson specialists, and I was told that, oh, you don't have it. And it's funny because, I knew in my heart of hearts that I had Parkinson's, especially with my grandmother and everything. And I could have just very well started taking medicine myself, and known that that's what I had. But I really tried to be, a good doctor, a good patient, comply and go see everybody and not start any treatment. So I suffered for 3 years. after, a few years, it really started to wear on me emotionally, because everybody kept saying there's nothing wrong with you. You're just depressed. You're just tired. And, maybe you need to see a psychiatrist, and I started to wonder, maybe I don't have, maybe it is in my head. Maybe, something not right. But I kept thinking, I know myself and I know something's not right. But and my employees, kept saying, you're not acting like yourself, working with me for 10 years. They knew what kind of doctor, what kind of person I was. So they could tell there was a difference in my, mood and my thinking. Even my patients I started to be so irritable, because one, I was in so much pain, and two, just it was very hard to multitask. And being a doctor, you have 20 million things going on all the time, especially as a neurologist. I think more so, because you're dealing with people that are already very compromised. They're falling, they're seizing, they're having strokes. I mean, I continuously had the firefighters in my office, the ambulance, because people are sick. And so when you're not feeling well yourself and you have to handle all these things, it really put me on edge, and I was very irritable. And I'm a very, people person and very social, and I always like to talk to my patients and hug them, and they would come in and say, oh, we don't mind waiting, because we were going to talk to you and hug you and kiss you, and and that was great. But after a while, I didn't want to deal with anybody. I was just like, bye, it's like, get out of here. And they were like, what's wrong? We came to you, didn't hug us today, you didn't give us you didn't ask about our children, you didn't ask. And I was like, I'm so tired. I just didn't want to deal with anybody. I just want to come home and get under the covers. And it was hard, because I had a 3-year-old, that I had to deal with, and, somebody that, needs their mom and wants to, play and wants to, I was exhausted. So I finally called one of my friends, good friends, who's a neurologist, and I told her, I don't know why it took me so long to go see her. I should have started with her initially. And I said, I know something's wrong with me. I know it's neurological. I think it's Parkinson's, but you tell me. And I told her, I said, if you think it's psychological, if you think that I just need a psychiatrist, then that's what I need to do, because I can't live like this. I mean, one thing, she just looked at me. She's known me forever. She was one of my mentors. She's known me since I was a resident, so she knows who I am. And she took one look at me and she said, Maria, you are exhausted. You look like you're just, worn out and not doing well. I said, I just feel like I'm going to break and, exhausted. And so she finally, after all the tests and everything, she said, you have Parkinson's. You have it in your brain, but not like you think. It's not, and I was so happy that she said you have Parkinson's, just because I finally got a diagnosis. I was like, oh, thank God, I'm not crazy. I knew there was something wrong, started on treatment. And then, of course, then there comes the, oh my God, I have Parkinson's. But the first thing was like, oh, thank God I have something. I know I was not crazy. So that's kind of, what happened. Initially, I was like, okay, yes, I got Parkinson's. Okay, we got this. I know how to treat Parkinson's. I've treated lots of patients. I treated my grandmother. I can do this. There's lots of new treatments, and people live well, better with it than they did, 10 years ago, 15 years ago. And so I was very optimistic. And then, it kind of hits you, because then you start realizing that it is a progressive disease, and it is something that, maybe your kids are going to have it, especially since I have a family history, and then, so I remember sitting there one day at dinner with my husband, and all of a sudden I lost it. I just started crying over dinner, like, oh my God, I have Parkinson's, and I don't know if we're ever going to be able to do what we wanted to do. Like, am I still going to be able to be a doctor? Am I going to be able to be there for my daughter? And it just kind of lost it there, which is very normal. And I encourage patients to do. I mean, it's a very normal reaction, but then you kind of have to get up and put your boots on and embrace it and decide that I can do this. But then the hard part came, because I thought, again, since I was a doctor, I know this disease, we're friends. I've been dealing with this forever. I trained in this. I know how to manage it. I know the medicines. And then didn't expect that just because I knew the medications didn't mean that my body was going to agree with them. So then came the, trying to deal with taking medicines and dealing with side effects and still being able to function as a doctor and being able to function as a mother and being able to function as a wife. And then I had the board start questioning me that was I competent, because now I had a disease because I disclosed it to them that I was sick because of my insurance liability. You have to, I didn't want anything to happen. And then, somebody said, well, she's, got Parkinson. But then they started questioning my mental capabilities. And so then it was like a battle I did not expect, that this is, again, that I thought that my community, my health professionals would understand that, this is not something that implicates your cognitive function, but then somehow that it was thrown into, is she competent? Is she able to manage? And that was a whole nother battle that I had to face dealing with that. And so managing medicines. And for a while, the medications made me so sleepy to the point that I couldn't drive. And so even though I finally got the diagnosis, I still, for a while, I didn't take any medicine because I couldn't function otherwise with the medicine at work, or I only took on the weekends, and I had to stop taking call because then I couldn't drive at night. I couldn't see the patients because I was so sleepy. I was falling behind the wheel. So for a year, I could not drive. And thank God for my staff and thank God for my friends, because they're the ones that helped me take care of my daughter and helped me take me to work because I was not able to drive because I was falling asleep. So this whole idea that I knew how to take care of Parkinson's, and, I was a specialist and I was an expert. Suddenly when it came to me, it was like everything was, out there. And it really took a good 2 to 3 years, another 2 to 3 years, to really find the right combination of medicines that helped me function, to where I could be myself and function and not be passing out and not be falling asleep and not be throwing up and not be, having all the dizziness or, low blood pressures. And so that was really an eye-opening too. And that's what I'm talking about, that being a patient is completely different than, you go to the doctor and they say you have a disease and here's this medicine and we'll see you in 3 6 months. But, you may not even be able to take the medicine and you don't know what to do. And I mean, fortunately, I'm a specialist and I'm a physician, so I kind of knew how to, troubleshoot some of the things. But yet still, it took me 2 to 3 years to get me squared away. So imagine somebody that doesn't know, oh, this is a side effect or this is a problem of that, and who do I call and when do I go to the doctor? And so that's been part of my work, trying to advocate not only to get early diagnosis for women, to be aware that women can have it too and how they look different, but also that just because you have a diagnosis and we have all these treatments doesn't mean that everybody's going to tolerate it, and that you do have to give time to adjust and to find the right combination. That unfortunately is not just as easy as here's this pill and you're going to be fine for the next 10 years. That is a lot of give and take, a lot of back and forth. That is hard if you're a mom. My doctors were 3 hours, 4 hours away, kind of like you're from Istanbul. So I had to go to my doctor, 3 hours away. And I have a child. So, when she went to school, it's like, how am I going to take her to school? How am I going to get back, in time to pick her up from school? And so all of that becomes, a big problem. And that's why I talked about this technology that, one thing that we got to experience with the epidemic was that we got some telehealth, but a lot of places it went away after the pandemic, but it really does help with people that have chronic illness or have children or have, jobs that can't take off a whole day. They have to provide for the family. And so you need to have an access to the care to be able to function and do well. So I recommend people to get knowledge, to learn about the disease, to find the tools. What is Parkinson's? What are the symptoms? What really is important? What's not important? Have idea of what are side effects of medications, and be empowered to speak up, especially in the minority communities, in the Hispanic community, here in the States, still even today, a lot of people would not ask the doctors questions. And so I encourage people to ask questions, to have, if you don't understand the terminology, and nobody, it's a whole new language, medicine, just like being a lawyer, have somebody that can help you. If you don't understand it, bring a friend, bring a little recorder, bring, write down notes, take notes down so that you can then discover what it is that you have, and ask doctors, your doctors, your stuff, your healthcare, say, can I call you back if I have any questions? Can I, what am I expecting? What is it, if I take this medicine, what is it doing? How long is it going to work? What if it doesn't work? What if I have problems? What if I side effects? Who do I call? And so it's really empowering you to speak up and ask for yourself. And that's how you learn and can take care of yourself. And it starts with self-love, because you have to put boundaries for you, that you have to take care of you. And it's very hard for a doctor who is always the caregiver, to learn to ask for help and to learn to take care of herself, and put her needs to. And you have to realize that if you're not well, like if you're a mom and you're a wife and you have a job, if you're not well, then all the people that depend on you cannot be well. So you have to take care of you. My daughter would not be well if I was sick. Who would take care of her? So I had to learn to ask for help, which was hard. Hard because you're supposed to be strong and independent, and so then ask the doctor, like, hey, what if I can't do this? What other options do I have? What other treatments are there? What can we do? When can we change it? And just ask, and not just be, well, I'll wait till my next appointment in 6 months and suffer, because fortunately we do have a lot of treatments, but it's a lot of trial and error. Everybody's different, and it's a combination. Sometimes it's not a particular medicine, but it's a combination that really works or doesn't work. Sometimes one pill can throw everything into the mix, and make everything bad, and sometimes it can make it all better. So it just really, really having to trust your doctor. And sometimes I see patients, they go from doctor to doctor frustrated because they're like, oh, I got sick and it didn't work. But it's a relationship, like everything else. It's like when you meet a friend, you don't become best friends overnight. You kind of get to know each other. It's the same thing living with the disease, and it's the same thing being with your doctor. It's a complex disease, and it really needs multiple disciplines to be able to treat the patient. And I really like it to be under one roof, one person to be kind of the coach of everything. Because unfortunately, what I see happening a lot is that, you have the neurologist on the one hand, and then you go to, say, a GI doctor or somebody else, and they have no idea what Parkinson's is. They have no idea what, you're dealing with, what medicines Parkinson's are. And so they try to manage the GI symptoms in an isolation, but they're not really taking into account the whole thing. It's the same thing with sometimes going to a physical therapist, occupational therapist. And I really think it would be good to have maybe a home health provider that can coordinate all the care, that can manage, the GI problems and the physical therapy and the, nursing care, and and also the social work problems, because, people need help with their kids, with their getting their medicines, with transportation. Those are things that we don't really focus on a lot. That, like myself now, 17 years into the disease, it's getting harder and harder for me to travel those 3 hours, because a lot of times I'm not well. And when I get down for weeks. Like we've been trying to schedule this meeting. I don't have, I'm not able to drive, and go, even though I need a doctor and I need my doctor to adjust. Fortunately, I'm a physician and I can, sort of been able to manage, myself. But a lot of people, they don't have that, and so they need to be able to have care. I said that a lot when, when you're really sick. My patients used to always tell me, I would say, you didn't come in for your appointment. And they would say, well, it's because I was sick. And I would not understand that. I would say, well, that's when you need to see me, right? And now I understand, because when you're sick with a neurological problem or even any other disease, when you have the flu or whatever, you can't get out of bed. You're throwing up, you're dizzy, you're fainting, you can't get dressed, much less drive. So how can you go to the doctor when you need to? And so this is when we need that technology. This is when we need that home health. This is when we need those experts to come into the house and say, hey, let's do your blood work. Let's do your vitals. Let's make sure you're not dehydrated. Let's get you on antibiotics or whatever you need. And that's what's missing in neurology. That's what's missing in Parkinson's, that when you get so sick and get down, especially as you progress down the stages, it's harder to go in and it's harder to keep your visits. But nobody's trying to say, hey, why? What's going on? Are you falling? Are you not driving? Are you, let's send somebody out to help. And that's what we need. And I think that that's where the link is missing. And if you can do something like that, where you can say, hey, we need to find out, if you're anemic because your B12 is so low from the Parkinson's, or your vitamin D is so low, or, or whatever, then we need to be able to fix that and treat it, instead of just saying, well, she couldn't come to the appointment, that's it, or saying, which I hate, saying, well, you didn't come in, so you must be non-compliant. I sometimes hear, I go to my doctors, and I have lots of doctors. I have doctors for, for almost every specialty, because of the complexity of the disease. And, sometimes is one thing and sometimes it's another. So I spend a lot of time with one doctor for a while, and then I spend a lot of time. And so when I go back to another doctor and they say, well, you didn't do all the blood work I asked. And I say, well, I did, but I did it with somebody else. You just need to get it. And they don't like that. And so they're asking you to repeat things when, you're already tired, you're exhausted, you have no money, and you're being poked and prodded. So you should be able to communicate. Or two, they give you this look like, well, you didn't follow up, so you must not care about your health. And it's like, can I tell you what I've been through? I've been in the hospital for the last 3 weeks. So how can I, and so sometimes, people are discarded as non-compliant or not caring, when they are caring. They're just living one day at a time, trying to survive and trying to manage a disease. And somebody needs to be able to put it all together and say, look, this is what's been going on. And it's not, that they're not trying. How can we help her or help him, do the things that are going to get her or him better, to be functioning in society, to be able to be, continue working, or being able to continue being a parent or whatever. I've written 3 other books, and I wanted to write something about faith, because I think faith is one of the reasons that I do so well and am able to continue and have a positive attitude despite all the craziness, that comes with living with a disease. Um, and so I started to write stories about, my stories of how I have, things that have happened to me and helped me, become a better advocate. But then it turned out that I was basically telling the story of how I became who I am, from the beginning. It's interesting. I'm not going to give it away, how I became a doctor, how I became a Parkinson's specialist, and all the things that I had to endure to be a doctor, being a woman, being a, Hispanic. And then how that's really helped me to figure out that we needed to empower women, and not just, in medicine, but also, women with the disease, women in general, empower them to be stronger, they are beautiful, and they have it in them to speak up, to stand up, and we need to stand together and united. So I started to write this book, and it's going to be called Making the Parkinson's Diva, how my whole story has evolved till now, and my, dealings with the disease, in hopes that it will inspire people to continue um, fighting, to not give up, and maybe give them some faith, especially in this world where sometimes seems like, no hope is left, that there is still hope, that we still can stand up and believe in something. And even when you have a disease and have all these struggles, you can still make something beautiful, and keep going. So hopefully it'll be out in the summer, Making of the Parkinson's Diva, the journey, the life, and the faith. So to try to inspire people. It's not medical, it's mostly, it's just my story. So, but it will give some insights to, all the things that we talked about, about being an advocate for women and Parkinson's. It's okay to cry. It's okay to accept your emotions, because, a part of you is lost. But you have to get up and embrace yourself, embrace the disease with all your uniqueness, your talents, your gifts. Because life, the one constant in life is that it's constantly changing. Nothing stays forever. So you can't really dwell that, oh, I lost something. We just have to make the best of what we have. And you can have, and I'm testament to that, you can have a full life, exciting life, living with a disease. Yes, it is limited in some ways. Yes, it is harder. Yes, there's going to be days you just want to cry and stay under the bed and not come out. But it's and it's okay to see that. It's okay, but it's not okay to just let those fears take over and be paralyzed and stay there forever. But you have to get up and remember who you are, and that you've overcome a lot, and that you will overcome this too, and nothing lasts forever. So it will change, and there's lots of treatments. And the one thing that always keeps me going, one is God, faith, and two is that I've been in this field for 30 years. And when I started this neurology, everyone laughed at me because thought, well, there's nothing new in neurology, what are you going to do? And since then, it's been the decade of the brain. We have all these treatments. So we have a lot of new discoveries, a lot of new treatments. And yes, we don't have a cure yet, but life can be better. And I think that we will continue to improve. So every time you feel like you want to give up, just think there's something else around the corner that's going to make you better, that's going to help, and hopefully, help your children and your grandchildren. So maybe even a cure. So